Now that we've established total calories and we've set protein as grams per kg or grams per kg of lean body mass, the next step is to set our fat intake. So let's talk about fat intake. Fat is 9 kcals per gram. It's the most energy dense of the macronutrients, and primarily it's used for energy. In fact, carbohydrate and fat are primarily energy substrates. Now, the fuel that you use changes based on the intensity of exercise, and fat is primarily used in low intensity exercise. With that said, we're almost always using protein, carbohydrates, and fat for fuel in some way. It's more so a continuum. It basically depends on the intensity of exercise and your individual genetics. So it's always important to remember that we're using all substrates simultaneously. However, fat does become the dominant fuel source as intensity goes down. This means we burn fat throughout the day and also during cardio, unless we're doing high intensity cardio. Fat is stored intramuscularly, that means within the muscle, and also subcutaneously, which is what we're primarily trying to reduce. Unfortunately, intramuscular fat stores, when they go down, makes your muscles look smaller. And this is why I think sometimes that bodybuilders look like they're just getting smaller at the start of prep without actually seeing a change in leanness. This is what I call the tweener phase. For example, when a male bodybuilder goes from about 16% body fat down to say about 13% body fat, there's not enough visual change in subcutaneous fat to look leaner, but the loss of glycogen and intramuscular fat makes them look a little bit smaller. It's important to help them realize this is normal, and this is not actually just loss of muscle, and that they keep going with the diet and eventually they will see the progress. There's also been a decent amount of research showing that low levels of fat is associated with lower levels of testosterone. Some people have recommended, therefore, that we keep a high fat intake for resistance trained athletes. However, resistance training is primarily a high intensity activity. So we have to think about fueling training, and that comes from carbohydrate. So we can't take this too far. Additionally, the vast majority of the research shows that energy availability, rather than the percentage of calories from fat, is mostly related with the drops in testosterone. In fact, multiple case studies have shown that bodybuilders tend to bottom out in their testosterone levels as they reduce total calories. So as you get leaner and leaner and leaner and you have to have your athlete drop calories, there's almost an invariable drop in testosterone and hormonal status will change. And regardless of whether you're at a moderate fat intake or a low fat intake, it's going to go down. However, we do want to preserve a minimum amount of fat intake, which we'll talk about in a second. Now, more often than not, bodybuilders are relatively obsessed with testosterone. This comes from the drug side of the sport. Steroids are basically synthetic forms of testosterone, and they do make massive changes in muscle mass. However, endogenous normal physiological ranges of testosterone don't have the same effect. And it seems that any amount in the range of normal physiological levels of testosterone won't make a massive difference in terms of your muscle mass. So this is not something we need to be totally concerned with. In fact, muscle mass is not the same as testosterone. They may be related in the long run, but during a diet, we need to be primarily focused on the big picture items like calorie intake and training quality. So we don't want to sacrifice carbohydrate by going too high in fat.